this is P.A. Jordan. Welcome to the show. Today's question is going to be,
My sinuses are always hurting. I can't take this pain and pressure. Why is this happening?
so this illustration helps us to talk about the sinuses. This would be the frontal sinus, draining downward into the nasal passage. It is hidden inside the frontal bone. Each person is uniquely designed. Some people have large, some people have small, some people have one large, some people have very little sinuses in this region at all. Each one is individual. Frontal sinuses drain downward into the nasal passage. Here we have the ethmoidal sinuses. Ethmoidal sinuses inside the ethmoid bone. Ethmoid means cuboidal sieve. It is a bone with many small perforations that allow the olfactory nerves to come down and detect our sense of smell. These sinuses produce mucus, and as that mucus flows out and drowns the back of the throat, it creates a humidification and filtration process. And this is the sphenoid sinus. It drains forward and down. All these sinuses are producing mucus. The mucus drains down over the nasal turbinates, and the turbinates drain it back down to the back of the throat. The turbinates have a wonderful job. Their job is to cause turbulence. That's where they get their name from, turbinates. So the turbinates cause the spinning of the air, which causes the pollens to rain out on the turbinates, and the spinning of the air also picks up humidification. So the air that goes down into your lungs has been filtered and has been humidified. So the sinuses have two jobs. One, they produce the mucus, which is the most important part of it, and they also lighten our head and have an influence upon the sound of our voice. That's when our nose or our sinuses get infected and we have a bunch of mucus accumulated here, we talk funny. Here we can see the frontal sinuses located in the frontal bone and the maxillary sinuses located in the maxillary bone. The maxilla actually means jawbone, so therefore we find them in the jawbone. They have an amazing cleansing system of cilia that pump or move the mucus produced there upwards towards the natural openings which are near the tear ducts. In the past, surgeons would create openings in the inferior region right here, a little doorway to let the mucus out, because that was often the complication of maxillary sinus infections. There's a pocket of mucus that wouldn't drain, and so it seemed natural to just make the opening here. But they forgot about the cilia, which were moving everything up and out, and if you make the opening here, it was non-successful. So nowadays, nasal antral windows are the openings that are made right up here. Surgeons will go in, increase the dimensions of this space, and allow that natural flow to come up and out and help to reduce the recurrence of sinus infections. And we can see how nasal irrigation can help our sinuses. What often happens is we end up dropping off all these particles and gluing them in place. Remember, mucus is sticky, and if you're not drinking enough water or if you're in a dry environment, the mucus can actually become a glue that holds the stuff that you're allergic to the surface that's allergic to it. So simply washing this stuff off with nasal irrigation gets out all the allergens and reduces the time they're there to harass you and cause the allergic reaction of inflammation and more mucus drainage. So that's why we want to do our nasal irrigation. And I always tell my patients, only do nasal irrigation on the days in which you plan to use your nose. Yeah, that's every day, so you should irrigate your nose every day. My chronic sinus sufferers, I tell them to do it twice a day. In the evening, the benefit is you wash out all the dust and particles that you picked up out mowing the lawn, raking the leaves. And in the morning, what you do is you wash out all the stuff from the night, but you also stimulate the cilia, which are the cleaning vessels. They wake up, they start doing their job, and you get a much better start to your day. Make sense? Do your nasal irrigation. Be kind to yourself. So, like the dictionary, this video is designed to help you understand your problems with allergies and sinuses. If you live in the Pacific Northwest, feel free to contact me at Dr. Nancy Becker's office in Enumclaw, Washington. Phone number 360-825-4466. If you do not live in that area, please see your provider. They will help you with customized, personalized medical treatments and interventions. So, hit like and subscribe below for more great information on sleep, upper respiratory problems, and ear, nose, and throat.